9 billion. If you own and operate a pair of testicles, that is how many sperm they churn out in the average month. The ability to put the population into population paste is one of the many reasons that male birth control has remained elusive. As it turns out, it is just easier to stop a single egg that is only alive for 24 hours and is only available once a month. See, sperm are pretty much the exact opposite. They are produced continuously every day at a rate of 1,500 per second. Not only that, they are highly mobile and can survive for up to a week once they are in the female reproductive tract. And despite what the internet will tell you, this is not for a lack of trying, because if there is a dollar to be had, there is a pharmaceutical company or device manufacturer out there that would like to take it. So let's talk about how to shut down the Purple Top Yogurt Shop. The first two are similar products. You can think of them a little bit like an IUD for the testicles. They are a physical gel that gets injected into the ductus deferens. That is the tube that transports sperm up through here behind the bladder and eventually out of the tip of the penis. The other option is something called Nestea, not the drink. This is going to be a pharmaceutical cocktail of hormones that stop sperm production, but at the same time keep testosterone levels relatively palatable, reducing side effects. And if you've ever wondered why it always seems like these things are coming soon but aren't ever actually here, that has everything to do with risk profiles. Because when you're making a drug for women, people who own and operate a uterus, the risk of the drug is measured against the risk of pregnancy, which is extremely high. For men, males on the other hand, it is measured against a risk profile of nothing, because we make the other person pregnant. There are no negatives. So when it comes to taking a drug, it has to be pretty much side effect free, otherwise it's very hard to market. Unfortunately, this only leaves us with two available options. That is going to be the wrap it up before you slap it up method, condoms. And then, of course, there is vasectomy, which is not quite that bad, but should be regarded as permanent. Yes, really. As a man who's had one, it's all over the paperwork.